Good morning. Pharmacies across America are the primary education and care point for most Americans to learn about their medication and disease states. Fortunately, pharmacists are abundant and highly accessible. It is important for patients to feel comfortable interacting with their pharmacist.
After all, interacting with at-risk patients is especially important because medication comprehension and adherence can be the difference between health and serious illness.
For example, it is vital for HIV patients to remain compliant to taking their medication because missing a dose can lead to a greater risk of a worsening HIV infection or developing AIDS. Homosexuals are at an even greater risk of developing AIDS, and they are even a victim of negative societal opinion, even when it comes to health care.
But shouldn't all patients be treated the same regardless of their sexual orientation?
That's my question mark. Let's see how a patient interacts in a pharmacy with their staff about his medication.
Hi, welcome to Drugs R Us Pharmacy. How can I help you?
I'm just dropping off a prescription.
Sure. Don't I know you from somewhere?
Yeah, we went to WVU together.
Oh yeah, I saw you at Jason's party. Or was it Matt?
Pretty sure that was Chris's place.
Oh, true.
Yeah.
Okay. Well, we'll see you back at 4?
Yeah, that sounds great. Cool, see you then.
All right. Oh my god, I know this guy from college.
Then pause it.
L-E-A? Who's that?
No, it's Eli. He's an old friend from college. He gets around a lot, if you know what I mean.
Truvada for HIV prophylaxis? Ew, no. I don't support that, especially not in my pharmacy.
Well, at least he's taking measures to protect himself and others.
Look, I really don't care. I'm sure he's a nice guy, but I don't feel comfortable filling this in my pharmacy, and I'm just not going to do it.
Is it appropriate for the pharmacist to behave in this way? Does he have a right to deny this patient's prescription based off his personal beliefs?
Is it appropriate for a pharmacy tech to gossip about the personal life of a patient to the pharmacist?
Now, let's see how the pharmacist interacts with the patient when he has to confront him that he's not going to fill his prescription.
Hey, I'm back for my prescription.
Hi, actually, it's not ready yet. The pharmacist wanted to talk to you.
Oh, really?
Yeah, I'll just grab it.
Okay, yeah, sure, no problem.
Hours later.
Hi, Mr. L-E-A?
Yeah, close enough.
Hey, I'm sorry to inform you, but I don't feel comfortable filling this prescription here.
Why not? I just got it from my doctor's office. It's signed and everything.
Yeah, I understand that, but this prescription hints that you've been acting, or hints that you've been wanting to do some risky behavior.
No, I'm getting it for the exact opposite reason. I'm doing it to be more safe.
Right, but from what I've heard is that you get around.
First of all, you don't know me, so don't assume that. And second of all, this is for me and my boyfriend. He happens to be HIV positive, and I'm trying to keep us both safe.
Okay, I understand. I mean, even if you do get around, even if you have one boyfriend, I still don't feel comfortable filling this.
That's fine. I don't feel comfortable buying from you.
All right.
Is this the correct course of action the pharmacist should have taken? In some states, there's what's known as a conscience clause, and the pharmacist can refuse to fill a prescription based off of their moral beliefs.
But doing this can ultimately cause harm. Now let's see how this should have gone.
Hi, welcome to Drugs R Us Pharmacy. How can I help you?
I'm just dropping off a prescription.
Sure. Don't I know you from somewhere?
Yeah, we went to WVU together.
Oh yeah, I saw you at Jason's party. Or was it Matt?
Pretty sure that was Chris's place.
Oh, true.
Yeah.
Okay. Well, we'll see you back at 4?
Yeah, that sounds great. Cool, see you then.
All right. Hey, I just got a new prescription. It's actually a friend of mine from college.
Oh, that's cool. It's always nice seeing people that you recognize.
Mm-hmm. But I've never seen that before. What is it? What is that drug for?
So this is Truvada. It's the only FDA-approved prophylactic medicine for HIV. So it helps prevent the spread of HIV with someone who's infected with HIV.
Oh, okay, that's cool.
Hey, I'm back for my prescription.
Hi. Actually, it's not ready yet. The pharmacist wanted to talk to you.
Oh, really?
Yeah, I'll just grab it.
Okay, yeah, sure, no problem.
12 seconds later.
Hi, are you Mr. Lea?
It's actually pronounced Eli, but
I was just about to ask you that. Are you French?
I am.
Oh, cool. So am I.
That's great.
That's awesome. Yeah. Hey, I just wanted to talk to you about this medicine before dispensing it. So
Okay.
I'm sure you're aware it's for HIV prophylaxis,
Right.
but it doesn't help stop the prevention of other sexually transmitted diseases. So you still want to make sure you use some other type of protection.
Okay.
Okay. And although it helps prevent the spread of HIV, if you do end up getting HIV, the dose may have to be altered, or you might have to be put on something else. So make sure you keep up with your testing and have regular doctor visits.
Okay.
Also, you want to make sure you stick to the dosing, because if you miss a single dose, it could potentially increase the risk of infection.
Okay, great. Thank you. I just have one partner right now is getting this for my boyfriend who's HIV positive, and I wanted to be as careful as possible. But I thank you for all the extra information. I'll make sure to go ahead and get tested every now and then and try to be careful.
Yeah, you're doing the right thing. If you have any other questions, feel free to call me, okay?
Great, thank you.
Yeah, no problem. Let me get this out for you.
All right.
That's a much better scenario. Ideally, this is how all patients should be treated regardless of their sexual orientation, ethnicity, or political beliefs. Part of the Code of Ethics states, a pharmacist promotes good of every patient in a caring, compassionate, and confidential manner.
This clearly states every patient and does not include any exceptions. We need to use beneficence in regards to respecting one's decision in both protecting them from harm and ensuring their well-being. Let's see how the patient felt when the pharmacist refused to fill his prescription.
When the pharmacist refused to fill my prescription, I felt very embarrassed and judged. I didn't think a healthcare professional would respond so negatively to me wanting to take care of my health and well-being myself and engage in prophylactic treatment.
However, the Code of Ethics also states a pharmacist seeks justice in distribution of health resources. Maybe this could be interpreted as only providing healthcare to patients the pharmacists believe are utilizing to do justice and not expose themselves to danger.
You're right. As you can see, there's much room for variable interpretations. There's many gray areas, so let's see how the pharmacist felt about the situation.
Perhaps I could have interacted with the patient a little bit differently, but I didn't feel comfortable dispensing a medication that caters to his desire to go into harm's way. I became a pharmacist to help patients, not to encourage them to do risky behavior.
Now remember, folks, it is our right as pharmacists to refuse service, but we did take an oath to ensure optimal outcomes for patients.
So go out there and start helping people and making a difference in healthcare.
But doing this can ultimately cause harm.
Wow.
I heard that you get around and the type of risky behavior.
Excuse me, I get around? What do you mean I get around?
And the pharmacist can refuse to fill a prescription based off of their moral beliefs.
But doing this leaves gap in patient care.
That's all, folks.